So diabetes is a result of your body's inability to produce or use insulin. So insulin is a hormone that allows your body to turn glucose or sugar into energy. If your body has difficulty metabolizing glucose, it can lead to high blood sugar levels, and this will affect your body's ability to heal wounds. In people with diabetes, wounds tend to heal more slowly and progress or worsen quicker. So it's super important to know what to look out for. The feet are the most common place of injury for people with diabetes, and a small wound on the foot can quickly turn into a foot ulcer. Foot ulcers can become very serious if left untreated, and about 15% of those who have diabetes develop a foot ulceration. That's why it's absolutely critical to do regular self-checks and closely monitor any wounds. Catching wounds early is the only way to reduce the risk of complications. Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over how diabetes affects wound healing. So let's get started. So when you have diabetes, there are a number of factors that can affect wound healing. So those are exactly what we're going to go over. So the first one that we have is high blood sugar levels. So your blood sugar levels is the main factor in how quickly your wound will heal. When your blood sugar levels is higher than normal, this prevents nutrients and oxygen from energizing cells. It prevents your immune system from functioning properly, and it increases inflammation in your body's cells. This all slows down the wound healing process. So next we have neuropathy. So peripheral neuropathy, it can be a result of high blood sugar levels, okay? When they are constantly high over a long period of time, this will cause damage to the nerve and blood vessels, okay? Once again, this is often in the hands and in the feet. So when this happens, you may not be able to feel irritants. So say you have a rock in your shoe. You may not feel that the rock is just eating away, causing a blister and then eventually an ulceration. When you lose that sensation, you may not be feeling that, okay? Which causes the ulcer. Next, we have poor circulation. So people with diabetes are 2 times more likely to develop peripheral vascular disease. So this is a condition of poor circulation. So peripheral vascular disease causes blood vessels to narrow, which reduces blood flow to the limb. This condition also affects the red blood cells' ability to pass through the vessels easily. A higher than normal blood glucose level will increase the thickness of the blood, affecting the body's blood flow even more. Next, we have immune system deficiency. So many people who have diabetes also have a problem with immune system activation. So the number of immune fighter cells that are sent to healing wounds is lower, and their ability to take action is often reduced. If your immune system can't fight properly, wounds heal slower, and then you're at a higher risk of infection. So the immune system and infection kind of go hand in hand, because if your immune system isn't working properly, then you're at higher risk of infection. So your body may struggle to fight off bacteria and cause infection. So higher than normal blood sugar levels can also increase the probability of infection. This is because bacteria thrive off the extra sugar in the bloodstream, okay? High blood sugar levels can also prevent immune cells from being able to fight off invading bacteria. If your infection is untreated and left to spread, this can really cause further complications like gangrene and sepsis. So there are things that you can do to help the healing process. So first, do regular self-checks. If we can prevent something from getting worse or even happening, that's what we want to do. Prevention over cure is always the easiest. So regular self-checks before we put on our shoes, making sure that we are shaking out our shoe, putting our hand in our shoe, looking at the bottom of the soles. Have we stepped on a tack? Is there a rock in the bottom of the shoe? Is there a rock in the shoe? Has a child put a toy in the shoe? Okay, all these things I have seen a tack in the bottom of the shoe where it has literally just eaten away at somebody's foot all day because they couldn't feel that. So we need to be making sure and checking before and after. So when we take off the shoes after, we want to make sure that we are checking our feet. Do those daily checks twice a day can prevent a lot of complications. Wearing white socks. Okay, so we can recognize right away if we take off our shoes, there's liquid on my shoe, or there's on my sock, there's blood, like even just a yellowness. If there's any type of drainage, we'll recognize it right away, which we might not see if wearing black socks. If we have a wound, removing dead tissue. Now, a doctor or wound care specialist will help you with this. If there is dead tissue, a wound cannot heal, but we also have to be very, very cautious with a patient with diabetes where we're using a very conservative technique and not taking too much. Okay. We also want to keep dressings fresh. We don't want to be leaving old dressings on there. If there's a lot of drainage, we may need to be changing them twice a day, just depending on how much drainage, how bad the wound is. But we want to make sure that we are putting a fresh dressing on there and it's not contaminated, making the actual wound worse. Next, we want to make sure that we're keeping pressure off the area. Pressure causes more damage to the tissue and will create a bigger wound. So when should we see our doctor? I always love to talk about prevention over cure. So really, if you start to have complications, you want to make sure that you're seeing a doctor right away. So if you have tingling, burning, loss of sensation, persistent pain, swelling in your feet, and you have diabetes, you need to be talking to your doctor. Even if you don't have diabetes, you should still be talking to your doctor to determine what is going on and see if there's any preventative measures that we can put in place to prevent further complications. Now, for patients with diabetes, we want to promote long-term health. Now, we want to promote long-term health in all patients, but this video, we're particularly talking about patients with diabetes. So what do we want to do to promote long-term health? Obviously, glycemic control. We want to make sure our blood sugars are within an acceptable level, okay? Eating a healthy diet, okay? We want to make sure that we are eating nutrient-dense foods. Box foods, they're so readily available, but we want to make sure that we're eating things with nutrient dense, okay? Our vegetables, our meats, our proteins, our fruits. We want to stick to the main food groups and not processed foods, okay? We want to make sure that we're staying active, and if you smoked, quit smoking, okay? This will help a lot. Smoking, it does constrict your blood vessels every time you have a cigarette, so it prevents blood flow even more. And when we add diabetes on top of that, it can create a lot of complications. So if you smoke, to quit smoking. So I hope you did find this video informational and where you can recognize why diabetes affects wound healing and the precautions that we can take to prevent further complications. But once again, that's all I have for this video, guys. I hope to catch you in my next one. Bye for now.